Hello everyone and welcome. Today's video is extremely important, especially for people living with diabetes or those who have a diabetic patient in their family. In this detailed video, we are going to talk about Actrapid injection. We will discuss what it is, how it works, when doctors prescribe it, how it controls blood sugar levels, its benefits, possible side effects, precautions, storage instructions, and many other important details that every patient should know. So make sure to listen carefully till the end because this information can be very useful for diabetic patients and caregivers. First of all, let us understand what diabetes actually is. Diabetes is a medical condition in which the level of sugar in the blood becomes too high. Our body has an organ called the pancreas. The pancreas produces a hormone known as insulin. Insulin helps sugar move from the blood into the body's cells where it is used for energy. When the body does not produce enough insulin or when insulin stops working properly, sugar starts building up in the bloodstream. This condition is called diabetes. There are different types of diabetes. In type 1 diabetes, the body produces little or no insulin. In type 2 diabetes, the body becomes resistant to insulin or does not make enough insulin to maintain normal sugar levels. Many diabetic patients can control their blood sugar with diet, exercise, and tablets. However, some patients require insulin therapy. This is where Actrapid injection becomes important. Actrapid is a short-acting insulin used to control blood sugar levels in diabetic patients. It starts working relatively quickly after injection and helps reduce high blood sugar. Doctors prescribe Actrapid for patients with type 1 diabetes, uncontrolled type 2 diabetes, diabetic emergencies, hospital patients, and sometimes during pregnancy if insulin treatment is necessary. Actrapid is known as a short-acting insulin because it starts working within approximately 30 minutes after injection. Its strongest effect usually occurs between 2 to 4 hours after administration, and it may continue working for around 6 to 8 hours. Because of this timing, doctors often advise patients to inject Actrapid approximately 30 minutes before meals. If a patient injects insulin but skips the meal afterward, blood sugar can fall dangerously low. This condition is called hypoglycemia. Now let us understand why insulin is so important. If blood sugar remains high for a long period, it can damage different organs of the body. Uncontrolled diabetes may lead to kidney disease, heart disease, vision problems, nerve damage, poor wound healing, and many other serious complications. This is why maintaining proper blood sugar control is extremely important. Actrapid helps the body use glucose properly and reduces excessive sugar levels in the bloodstream. Now let us talk about how Actrapid is used. Actrapid is usually injected under the skin. This method is called a subcutaneous injection. Common injection sites include the abdomen, thighs, upper arms, and hips. Patients should avoid injecting insulin repeatedly into the exact same area because it can damage the tissue under the skin. Doctors usually recommend rotating injection sites regularly. Before injecting insulin, patients should wash their hands properly and check the insulin carefully. The expiry date should always be checked before use. If the insulin looks unusual, cloudy when it should be clear, or appears damaged, it should not be used. Some patients use insulin syringes while others use insulin pens. Insulin pens have become very popular because they are easy and convenient to use. One very important thing to remember is that insulin dosage is different for every patient. The correct dose depends on multiple factors including age, weight, blood sugar level, eating habits, activity level, and overall health condition. Patients should never copy another person's insulin dose. Only a doctor or diabetes specialist should decide the correct insulin dosage. Blood sugar monitoring is also extremely important for patients using insulin. Many patients use a glucometer at home to check their sugar levels regularly. Tests like fasting blood sugar, random blood sugar, and HbA1c are commonly used to monitor diabetes control. HbA1c provides information about the average blood sugar level over the previous 2 to 3 months. If sugar levels remain high, the doctor may increase the insulin dose. If blood sugar becomes too low, the dose may need adjustment. Now let us discuss hypoglycemia, one of the most important complications of insulin therapy. Hypoglycemia means low blood sugar. It can happen if a patient injects too much insulin, skips meals, eats less than usual, or performs excessive physical activity without proper planning. Common symptoms of low blood sugar include sweating, shakiness, dizziness, hunger, weakness, rapid heartbeat, headache, confusion, and blurred vision. In severe cases, hypoglycemia may cause unconsciousness or seizures. If low blood sugar occurs, the patient should immediately consume glucose, fruit juice, candy, sugar, or another fast source of carbohydrates. Severe cases may require emergency medical treatment. This is why diabetic patients using insulin are often advised to carry some sugary food or glucose tablets with them. Now let us discuss hyperglycemia. Hyperglycemia means high blood sugar. If insulin doses are missed or if the body requires more insulin than usual, blood sugar levels can rise. Symptoms of high blood sugar may include excessive thirst, frequent urination, dry mouth, fatigue, blurry vision, and weakness. If blood sugar becomes extremely high, dangerous complications such as diabetic ketoacidosis may occur. Diabetic ketoacidosis is a serious emergency condition that requires immediate medical treatment. Now let us talk about the side effects of Actrapid. Like every medicine, Actrapid may also cause side effects in some patients. The most common side effect is low blood sugar. Other possible side effects include redness at the injection site, swelling, itching, mild pain, weight gain, and weakness. Some patients may experience allergic reactions. If severe allergy symptoms appear such as breathing difficulty, facial swelling, or severe skin rash, immediate medical help should be taken. Diet is another extremely important part of diabetes management. Insulin alone is not enough. Patients should also follow a healthy diet plan. Doctors usually advise diabetic patients to reduce sugary foods, soft drinks, bakery products, fried foods, and excessive junk food. Fresh vegetables, balanced meals, healthy proteins, and fiber-rich foods may help maintain better sugar control. Regular physical activity is also very important. Exercise improves insulin sensitivity and helps the body use glucose more effectively. However, insulin users should monitor blood sugar carefully before and after exercise because physical activity may lower sugar levels. Now let us discuss storage instructions. Actrapid insulin should usually be stored in a refrigerator. However, it should never be frozen. Extreme heat and direct sunlight can damage insulin and reduce its effectiveness. Patients traveling in hot weather should use cooling packs or insulated bags to protect insulin. Many people believe that starting insulin means diabetes has become extremely severe. This is not always true. Some patients naturally require insulin from the beginning, especially those with type 1 diabetes. Others may need insulin later when tablets alone cannot control blood sugar properly. Using insulin is not a sign of failure. In fact, proper insulin treatment may help prevent serious long-term complications. Now let us discuss elderly patients. Older adults using insulin require extra attention because they may have a higher risk of low blood sugar. Patients with kidney disease or liver disease may also require special dose adjustments. Children with diabetes may use insulin as well, but their treatment should always be carefully monitored by specialists. Another important topic is insulin resistance. In type 2 diabetes, the body often becomes resistant to insulin. Weight loss, healthy eating, and exercise may improve insulin sensitivity. Some patients use insulin together with diabetes tablets for better sugar control. Timing is extremely important when using Actrapid. Because it is a short-acting insulin, it is usually taken before meals. Missing the correct timing may cause blood sugar fluctuations. Patients should try to maintain a consistent daily routine. Smoking and alcohol can also affect diabetic patients. Smoking increases the risk of heart disease and blood vessel damage. Alcohol may disturb blood sugar levels and sometimes increase the risk of hypoglycemia. A healthy lifestyle is very important for diabetic patients. Stress management also matters. Stress hormones can increase blood sugar levels. This is why mental health and emotional well-being are important parts of diabetes care. Patients should also attend regular medical checkups. Besides sugar monitoring, blood pressure, cholesterol, kidney function, and eye examinations should also be checked regularly. Diabetes can damage the eyes, kidneys, nerves, and blood vessels if it remains uncontrolled for a long time. Foot care is another important area. Diabetic patients should check their feet regularly because wounds and infections may heal slowly. Comfortable footwear and proper hygiene are important. Now let us discuss common myths. Some people believe insulin becomes an addiction. This is completely false. Insulin is simply a treatment that replaces or supports the body's natural insulin. Some patients are afraid of injections, but modern insulin pens and fine needles have made insulin use much easier and more comfortable than before. Doctors and diabetes educators can teach patients how to use insulin properly. Emergency situations should always be taken seriously. If a patient becomes unconscious or develops severe low blood sugar symptoms, emergency medical assistance should be obtained immediately. Family members should also learn the signs of low blood sugar and basic emergency care. Actrapid may interact with some medicines. Certain drugs may increase or decrease blood sugar levels. Patients should always inform their doctor about all medicines they are taking. Pregnant and breastfeeding women should only use insulin under medical supervision. Now let us discuss a practical example. Suppose a patient has consistently high fasting blood sugar despite using diabetes tablets. The doctor may decide to start insulin therapy. The patient receives guidance regarding dosage, timing, meal planning, and sugar monitoring. If the patient follows the treatment plan carefully, blood sugar control may improve significantly. However, if insulin doses are skipped or unhealthy eating habits continue, complications may develop. Diabetes management requires teamwork between the patient, doctor, family members, and healthcare providers. Some people ask whether insulin must be used for life. The answer depends on the type of diabetes and the patient's condition. Patients with type 1 diabetes usually require lifelong insulin therapy. Some type 2 diabetic patients may reduce insulin needs through lifestyle improvements and weight management. Healthy sleep, hydration, exercise, stress control, and regular follow-up visits are all important for diabetic patients. Patients should contact their doctor immediately if they experience repeated low sugar episodes, severe weakness, vomiting, breathing problems, infections, fever, or allergic reactions. Education and awareness play a major role in diabetes care. Patients who understand their disease are usually better at managing it. Meal planning is also very important. Skipping meals after insulin injections can be dangerous. Balanced meals with proper carbohydrates, proteins, and fiber help maintain stable sugar levels. Traveling with diabetes requires preparation. Patients should carry insulin, snacks, water, and glucose monitoring equipment while traveling. Extra insulin supplies should also be kept available. Exercise routines may sometimes require insulin adjustments. Some patients need snacks before exercise to avoid low blood sugar. Each patient's needs are different, so individualized medical advice is important. Weight gain may occur in some insulin users, but proper diet and exercise can help manage body weight. Preventing diabetic complications involves controlling blood sugar, monitoring blood pressure, avoiding smoking, exercising regularly, and attending medical checkups. Emotional support is also very important because diabetes is a lifelong condition for many people. Family encouragement and a positive attitude can help patients manage their condition more effectively. Modern diabetes treatment methods have improved significantly. With proper treatment, many diabetic patients live long, healthy, and active lives. Actrapid can be highly effective when used correctly. Now let us discuss insulin overdose. If too much insulin is injected accidentally, severe hypoglycemia may occur. Symptoms may include sweating, confusion, seizures, unconsciousness, and even life-threatening complications. This is why insulin doses should always be measured carefully. If a patient is confused about dosage instructions, they should immediately consult a doctor or pharmacist. Parents of diabetic children should also educate teachers and caregivers about diabetes management and emergency sugar treatment. Infections and illnesses can increase blood sugar levels. During fever or illness, some patients may require insulin dose adjustments. Doctors often provide special instructions for managing diabetes during sickness. High blood sugar may also cause dehydration. This is why proper fluid intake is important. Now let us discuss diabetic ketoacidosis again because it is extremely serious. When the body does not receive enough insulin, it starts breaking down fat for energy, producing harmful substances called ketones. Symptoms may include vomiting, abdominal pain, severe weakness, rapid breathing, and fruity-smelling breath. This condition requires emergency hospital treatment. Ignoring insulin therapy can be very dangerous. Awareness and discipline are the keys to successful diabetes management. Actrapid is an effective short-acting insulin, but correct usage is essential. Now let us quickly summarize the main points. Actrapid is a short-acting insulin used for diabetes management. It usually starts working within 30 minutes. It is commonly injected before meals. Low blood sugar is one of its most important side effects. Regular sugar monitoring is necessary. Healthy diet and exercise are essential parts of diabetes care. Insulin should be stored properly. Patients should never change insulin doses without medical advice. With proper treatment and awareness, diabetic patients can live healthy and active lives. Thank you for watching this detailed video about Actrapid injection. I hope this professional explanation helped you better understand insulin therapy and diabetes management. Take care of your health and always follow your doctor's advice.